thank you first and foremost, Bethany, for being here. I've been looking forward to any conversation that you and I have truly all the time, but
Mhm.
in a more formal setting like this, I think it's really exciting to be able to elevate your voice and elevate any woman's voice in regards to a topic specifically like on their heart and something that we feel passionate about. But I just wanted to give our listeners a little bit of context, like who you are, kind of how you show up within this Victor's brand and in this Victor's mission. Um, and what you do for a living, obviously, is a huge part of that, but who you are as an individual is also a huge part of that. You are one of our referred or preferred providers that we refer to within the Victor space. You function out of our Victor's Lincoln location part time, and then you also are functioning now inside Wellity, which we just had a conversation with MJ a couple weeks ago as well, or Mary Jane, I should say. I know a lot of people don't know her MJ. Um, but, and you're just at those two locations now, right? Here in Lincoln?
Yeah. Yep.
Okay. And you are an occupational therapist, but specializing in core and pelvic floor, but really like a whole body approach. So maybe
Mm.
just give us just a little outline of who you are and what you're doing professionally to support the world around you right now.
Okay. Well, like Stacy said, I am an occupational therapist, and I went into OT because I really liked the kind of not holistic
Mhm.
kind of lens that it has, just inherently. So occupational therapy is pretty similar to physical therapy in that we're a rehabilitation profession, and we look at the neuromusculoskeletal system. Um, but also, we kind of have this like mental health piece and this other like looking at someone's, daily occupations, and that can be really broad or that can be really narrow. And so, again, like that kind of approach and that broad thing is what really drew me to OT. And then when I was in occupational therapy school, I was always really, again, kind of drawn to like, I want to do something a little bit different. We had a lot of like acute or hospital based training, and we had things for skilled facilities and then hand or like outpatient stuff. But I remember specifically, like when we were doing research, I was really into researching like alternative methods to things. Well, um, my last rotation for school, I got to go to a facility in Grand Island called Women's Health and Healing Center. And I had been, in terms of in terms of women's health, I'd been exposed to like breast cancer rehabilitation, but I'd never heard of pelvic health. Um, and I was like, oh my gosh, this is so important. Like, there are things, I'm a 23-year-old, and there are things that I'm experiencing that I didn't know this was normal, or I didn't know that, or that this wasn't normal, and that I didn't know that there was like that I could help with this. And
Mhm.
so I finished that rotation, and I should say that I was exposed to the to lymphedema treatment, and so again, more kind of like some alternative treatments for that, and um, breast cancer rehab and women's health just in general. And so then before I even graduated, I started my training in these things, and I've just been very passionate about like bringing awareness to things that maybe aren't super well known, whether that be like the lymphatic system, or whether that be pelvic health, um, I mean, digestive dysfunction, like, and I mean, the things that I could list are kind of endless, but um, I've been really interested for, gosh, I think it's been like 8 years now that I've been doing it. Um, and now I'm happy that things are starting, like that there's a trend,
Mm.
that there's more awareness of these things now. So
Yeah.
yes, um, I'm Mary Jane sees very, a lot of the people that I love to help. And so it's been really great being able to work out of there too. And the Victress space, I mean, it's just an amazing place. So I'm happy. I'm happy.
Hmm. I mean, what we're happy to. I remember, and we can go in again. I feel like you're going to be one of those recurring guests on here because they're like you and I could go on for hours on all of the topics. But so I won't go too far into this, but I remember when Stassi and I were first getting started with Victress, we were, starting to reach out to professionals or whatever. And I don't remember where or who sent me your name, but I know I remember your name came across like our list of like people that we needed to align with. And I remember being like very, I'm not intimidated, but like, oh my gosh, like, yeah, I'm gonna have to reach out to her, but I'm not ready for that quite yet. And then I swear, like 2 days later, you reached out to
I
us,
was
like
going
you
to
had
say,
heard about us. And I was like, oh, I was like, that's her. That's the girl that I was talking about. So yeah, just a silver lining there of
Mhm.
the good old days of our story. But yeah,
I know.
I knew that what you were doing and the way that you were doing it, even in, outside of our space, was so important. And Tracy and I talked about it in a previous episode. Like when we started doing this stuff, like it really wasn't something that a lot of people were talking about. It wasn't a space that a lot of women were felt comfortable even addressing. We talk a lot about things being normal and common, and what does that mean? Just because something is common doesn't make it normal. And so trying to like change those narratives around what women were experiencing postpartum, but also like 10, 15, 20 years postpartum or for their whole lives, like you said, like before even having a baby at 20, at the age of 20, like all of these like potential issues that are underlying that just are getting dismissed. And so when I approached you about our conversation today, I thought your answer was very interesting in regards to, what is it? So what is something that you feel really passionate about right now that you want to speak to and have a platform to speak to not just our members, but hopefully the broader community. And you mentioned the topic of medical gaslighting. And for the purpose of keeping things as positive as both I know you and I want to maintain the conversation, we could throw around the word medical dismissal versus maybe medical gaslighting. But it was funny, I was just talking with Amber in the other room about us calling it that for this conversation. She's like, are we gaslighting ourselves out of calling it gaslighting?
That's so
So I
true.
was like, yeah, maybe we are. I don't know. Maybe we are. But ultimately, I think it's a very important conversation, especially around women's health.
Mhm.
And the minimization and the realities of what women are up against. I've had my own experiences of, medical dismissal, medical gaslighting, whatever you want to call it. And I know you have, and I know pretty much every woman in my life that I've encountered has
Mhm.
had some sort of experience, and maybe they haven't realized it yet. So, in your words, can you explain like what a medical gaslighting or medical dismissal is, and why some theories I would say on why you think it is disproportionately affecting women?
Yeah, so I was also thinking about this earlier because you had brought up that, we'll call it medical dismissal and like that's wonderful. And I was kind of thinking about, well, first of all, in general, what we are referring to it as is as um, going to a healthcare professional and maybe you're experiencing symptoms or you are something doesn't feel right or whatever it is, you're going to your healthcare professional and then they are um, not maybe validating you or they are brushing it off or saying it's not a big deal. And then you leave, you know, with no answers and with no progress and whatever it may be. And again, I was thinking, I think there's like a almost like a spectrum of kind of how this can happen. And, on one hand, physicians may unintentionally, like completely unintentionally, be dismissing something maybe one of your concerns, and may be doing that to try to actually be helpful. Like if I go to someone and say, oh gosh, I'm really tired. Like I'm just always tired, and I don't, I wake up tired, and I can barely make it through the day, whatever. And a physician might say back to me, well, I mean, you have twins, right? Or like it's totally normal. Like that's completely normal. Instead of maybe giving me solutions or listening to me further. I think that can maybe be more like medical dismissal versus
Mhm.
like gaslighting sounds to me a little bit more intentional. And I don't know, I think probably the intention doesn't necessarily matter, but
Mhm.
more like, refusing a test or refusing a referral somewhere because it's nothing, or it's, you're whatever is cause your
Yeah.
middle age, or whatever it is, um, kind of maybe finding like an excuse but not being proactive, or um, it might be something like, you know with their ego, in terms
Mhm.
of, I don't know what it is, I'm telling you that it's nothing, like we're not going to do anything about it. So again, I kind of was also thinking about those, and I think that there's probably um, differences and not that it necessarily matters in how it's making someone feel, or like, the bottom line, but I do think intention does matter. So
Absolutely. That's a really, really good
mhm,
point that you make there. I
mhm,
think that we want to believe that a lot, all any medical professional, anybody that is seeking service is in the business of bettering people and giving them the best resources possible. But yeah, I think that there could be some intentional dismissal, or unintentional dismissal, but also some scenarios that when someone doesn't feel confident or doesn't know how to address it, or maybe just doesn't want to address it, they
mhm,
may approach that concern a little bit differently.
mhm,
Um, and as far as like, we know from research anyway that disproportionately this usually
mhm.
affects women more
Yeah,
so, right?
yeah,
Like we know we present with symptoms, and a lot of times unfortunately, a lot of the times the first go to is our mental health. How are we doing mentally and emotionally when we're presenting with physical symptoms? Which there's a lot of different theories as to why that is, ranging for over many different years of many different programmings, I'm sure. But do you have any other theories on like why this is, like, why the act of dismissal or gaslighting is, intentionally focused, or unintentionally or intentionally
yeah.
disproportionately affecting us?
So yeah, I mean, I I think that we're a little bit more intuitive, right? Like women are, we maybe feel things a little bit earlier. Now, I can't speak for every woman because I know many that, um, have difficulty connecting and kind of knowing what's going on. But I definitely think we feel more, um, and may then be more apt to ask for help, like when we are feeling like something's off. Um, I also think that hormones, we have a lot more fluctuating hormones, and not only at, within a month, but within our entire life, that's fluctuating so much. And there's different stages that we're going through that we have to figure out like a new normal. And what does that look like? And we're going to these professionals, and the research definitely isn't there, right? There's many reasons why it's difficult to get ethical research on women, pregnant women, whatever. And so it likely is just impacting us more because we're experiencing more symptoms, and
Mm-hmm.
we are going to our professionals because we don't want to. And I think that's
Mm-hmm.
actually been, um, something that, social media has been great about. Physicians would probably not agree with me on that, but like highlighting the things that we have maybe been told by people, like that's just a normal part of postpartum. That's just a normal part of perimenopause. That's just a normal part of menopause. Oh, you're gaining weight, well, are you exercising? Are you eating? How much are you eating? Whatever. And so we just, it's something that is unfortunate, but women are just experiencing it more because they're going to
Yeah.
their professionals more.
Yeah. Yeah. I have been reading a book on menopause recently, and she was talking about she's a OB and but has certified herself in so many different things, right? Like as an occupational therapist, you go to school and you get your occupational therapy, and chiropractic, you go to chiropractic school and you get the ability to adjust. Like, but there are so many other trainings and so many other things that you have taken upon yourself to learn intentionally as an occupational therapist in your scope of practice that you have chosen, right? It's not like just like all encompassing, like,
Mm-hmm.
you're going to treat everybody type of thing. Like you found your lane and you found your scope of practice. And she talks about how in, obstetricians, for example, um, you know, they are going through their medical school training and they're getting that basic knowledge. But when it comes to menopause specific knowledge, there really isn't any education like directed to that demographic. There's some very basic level stuff. I think that is now changing from my understanding, from what she was discussing in medical school classes moving forward. But really, like, their most OBs is probably where women go to find women's health resources. And I'm not saying that all OBs don't have that for women, but they're unfortunately, unless they've taken it upon themselves to continue to educate themselves and supporting, that training may not have happened. So they are functioning from with almost just as much potential information that we might be able to get resources to, and that's no fault necessarily of their own or anything to that extent. It's just women are getting frustrated because we're not getting answers when we're having these concerns and feeling like my concerns aren't valid, or that it's like you said, like it's normal for you to be tired with the mom of twins. I know, I mean, like I said, each one of us could share our own stories, but just to give an example of like a medical gaslighting situation, I personally experienced that in going to the ER a few years ago. I know what menstrual bleeding is. I've done it a few times over my years. And I had a particular period, day two. I'm always a little bit heavier, but this one was really, really, really heavy. And it was active bleeding in a way that like, I'm like, this is red. This isn't just bleeding. Like, I feel like this is an uptick in bleeding. Like something's off. Like, yeah, I don't need to spare you the details, but it was a lot. And so to the point where I was like laying on the floor, I couldn't really get up. I was very dizzy, all of those things. And so I ended up going into the emergency room and being seen in the emergency room. And they did some blood work, and I was essentially told that my potassium was low. And I was asked about my current state of life. And I said, yeah, yes, I'm going through some stressful situations in life, but as is everybody else. And they gave me some potassium and told me to really watch my mental health and that I should, start to feel better, and it can really affect my periods that way. And I was like, okay, well, I guess, like, yeah.
Mm-hmm.
I mean, this is not too long ago. I know enough that should
Mm-hmm.
not have been the scenario that I experienced. Um, and it was a female physician as well. It was just a very, like, I think when you're in the moment, and I was starting to feel better and it was starting to slow down, I think due to the ibuprofen that I had taken. But I got home and it started up again, and I was getting scared. And so I'm working with my midwife, who was on maternity leave at the time, about it. And so she sent me to the office the next day, and turns out like I had just ruptured a cyst about the size of my fist, like on one side. And I didn't have any pain with it, at least not that I remember. So to have that experience go down, and then to feel like if they had just done an ultrasound, they would have known. If they had just, asked maybe some more questions or dug a little deeper, or just taken the time to like go beyond just the assumption that my stress life or my stress levels is affecting, um, in my scenario, that situation. But a lot of times it's the weight gain, or it's, the changes in energy levels or whatever it may be. And then we're getting dismissed, and we're not actually getting answers, to and or then solutions, or getting somebody to dive into the weeds with us, right? And that's, I think, what both of us see very consistently in both of our professions.
Well, and I also, I mean, I think diagnosing or using like depression as kind of an out or a diagnosis is a big one too. Like, I'm experiencing these symptoms. I'm not interested. I'm having depression, right? We're going in and we're telling our physician this, and they, instead of like looking into ways that, gosh, well, what's going on? What's the underlying cause for these things? Just try not to stress out, um, decrease your stress. We'll give you this medication. We'll, I'll check back in on you. Like, and sometimes it's not even I'll check back in on you. Sometimes it's just, okay, you know. And I think that and depression and just get your stress under control, like, are two big cop outs. And I agree that um, most things are stress related, and many of them can cause depression, but it doesn't mean that, like, even if like the physician is giving a diagnosis of, oh, depression, and then giving them a medication for that, I still a little bit feel like that could be some like dismissal, because we're not really listening to what's going on. We're not really looking for answers to the concerns that someone's actually bringing in. I don't feel myself. I don't, do, I'm not happy, and so instead of maybe doing the appropriate tests or referring to someone, it's chalked up to these other things and not addressed. And then that doesn't actually help at all. Typically okay, I can't say that like a medication's not going to help. Potentially that's something that can help. But are we really getting, is that all? Is that enough? Are we getting to the root of the issue? And so I see that a lot.
Yeah. Yeah. When you're working with a healthcare provider, what are things that either the healthcare provider themselves that we should be hearing as patients when we're going into those rooms with our concerns? What are some things that questions that should be asked, or
Mm-hmm.
any of the, like, a pause that maybe that needs to happen,
Mm-hmm.
because I think that's a lot of it, right? Like, it's, are questions even being asked, or is there a lot of different just assumptions? Because I don't know if a lot of women know what to ask or what to
Mm-hmm.
say to get
Mm-hmm.
to that solution, or to try to take the journey to that solution.
Yeah.
um do you have any, I don't know if it makes it easier to make a scenario, but is there anything that you could speak to in regards to, like, what are some red flags? Obviously, like, we know the red flags, but maybe some solutions, where you could lead the conversation.
So I tell people this all the time, like, write down what you want to tell your physician. Like, I don't care how good of a relationship you have with them. I don't care how you think that you're going to be able to tell them your symptoms and you're going to be able to tell them what you're experiencing. When you get into that room and, maybe you've already talked to your nurse or whatever, and then things kind of start to sound like, oh, maybe they're not that big of a deal, like kind of in your head. And you are bound to forget some details. Maybe your physician asks you something, you kind of can't remember like what date something happened or the order of which something happened. Maybe you can't really remember the severity of the pain or the symptom that you were having. And so the physician doesn't necessarily have all the information that they need. And so writing down things that maybe you don't even know if they're important or not, time of day that you're experiencing symptoms, time of your cycle that you're experiencing symptoms, if you've correlated that at all, or if you haven't, paying attention to that. Like, is this something potentially hormonal or is it recurrent that's happening? Again, is this maybe something that's happening because of some food that I'm eating? Or is this happening after I'm eating despite what I'm eating? Just all of these different things. Like, I really want you to look at and have a good understanding of and words to be able to show your physician, because that's how they're going to be able to start helping you, is hearing your information and then also knowing, is there anything that you've already tried? Maybe again, like, you can go as far as to tell them, I'm having these symptoms. I actually already have been kind of researching some things that I think it might be. But you're the expert. And so can you, maybe look through these things and let me know? And again, if at that point, if they are looking through and or not looking through, again, that can be where potentially, I hate to say ego, but like potentially a physician may get offended that you're going to, or annoyed that someone's going to Dr. Google, right?
Mm-hmm.
And when they're the expert, but if they are not sitting down with you or helping go through that list with you and listening and, okay, what are these next steps? Then, they're not trying to help.
Yeah.
They're not being helpful, and they're not, maybe they don't align with you well.
Mm-hmm.
So, in terms of like a specific question, I have seen this come up too, but if you do feel like you're getting dismissed, or if someone's refusing to refer you somewhere or refusing to order a test or something like that, you can ask them, will you document why you're refusing? Like, first of all, ask them, why do you not feel like that's right for me? And then can you document that? Like, that maybe, I wanted some extra blood work and you didn't feel like that was necessary. Or I wanted a referral to a specialist and you said that it was nothing, you know.
Mm-hmm.
So I think,
And the benefit of them documenting it is to, I think that it's not necessarily always just to like cover yourself or, or putting them in a case of a potential lawsuit. Like that's not necessarily what we're talking about. It's more I'm assuming here, so correct me if I'm wrong. It's also like, what if, you go to somebody else and they're looking for something and all of a sudden your insurance might not provide it or they're not going to cover it because, it hadn't been tested in the first place. Whereas, you had seen somebody that you were asking for that test and then it wasn't approved, right? Like we're
mhm.
looking at a bigger spectrum of why that documentation is important.
Yeah, there's all different kinds of reasons why the documentation can be important. But them leaving that out and you like, as medical professionals, we're supposed to document everything. If you don't document it, it didn't happen. And so you asking for that says, okay, I want you to acknowledge that I just asked for this and you said no. or and the reasoning. So
Hmm.
yeah.
Yeah, absolutely. Um, what role do you think that continued education and training it can play in preventing like medical dismissal, medical gaslighting, both in and of itself? I like your concept of like them being kind of different things, but
Mhm.
what role do you think that continued education can play in that within women's health?
I mean, I think it's huge because our research is always changing. I mean, it is all like recommendations of what we should have done years ago versus what we're finding now can be completely different. And so I often find people with, or I discuss this with individuals who have endometriosis a lot, um, because that is a situation where it can be a really like invisible diagnosis, right? Like and the only way that that's diagnosed truly is through laparoscopic surgery or through surgery. And so staying up on the research for physicians to know what is what's really the best for my patient. Is it is well, I will say research is finding that the earlier the surgery that we can get that excision, the better, versus putting someone on birth control to manage it. And so, again, that's just an example, but I think that, I mean, it's everything staying
Yeah.
current because otherwise you are unintentionally knowing or unintentionally saying that something's nothing when we have this new research that um, shows that women are experiencing this or this can be helped or
Mhm.
again going back to hormones, they are so tricky and so confusing and so different on different people. And so it's important, and that's also why it is important to not go to your primary care physician or an OB who maybe doesn't have as much knowledge in things like hormones,
Mhm.
and
Yeah.
finding an appropriate professional and hopefully your initial the whoever you go to first, hopefully they're not dismissing you and helping you to find that.
Yeah. Helping you to lead you in the direction of that
Hopefully
resource.
they, know, even if they don't know the specific research themselves, hopefully they know like, oh, you know what? I know there's been a lot of updated research on this, and I
Hmm.
know an endo specialist or I know someone who needs to know this. Let's get into contact with them. Let's get you a
Yeah.
conversation with them.
Yeah. And I
Mhm.
think, I would say an example of this, and I think it's getting better slowly but surely. But speaking to specifically like one area of your scope of practice or your specialty, I should say, being, the pelvic floor, um, I hear a lot in the gym, of different pelvic floors symptoms or concerns. Obviously, like my scope as practice is not to diagnose anything like that, but absolutely, I know the symptoms well enough to refer, and as do the coaches within the Victor's movement space. But the usually a lot of times what I hear is, well, I went to my OB and they did an evaluation and they said everything looks normal, and so then that's kind of where it stopped, right? Like they came in at one point and had a concern, and then it just kind of stops after that, maybe. And I'm not saying all OBs is that way, but, and I think, like I said, it's changing, right? Like the
Mhm.
generation that my mom and our moms, went through versus I think the women of millennials are kind of like, hello, like something's wrong.
We
Like
matter.
yeah, exactly. We're kind of demanding some changes. So I think that that's good, and we are
Mhm.
starting to see those changes. But I even remember my own mom. Like I remember after having Cohen, like I was like, oh my gosh, like I have to pee like so fast. Like it's very urgent. Like I need to go like right now. And she's like, well, yeah, you just had a baby. And I was like, oh, okay. She's like, that's
Mm-hmm.
just how it is. Like that's just welcome to being a mom, you know?
Mm-hmm.
And, just I joined the club kind of
Mm-hmm.
feel. Obviously knowing what I know now, like that's not necessarily the case.
Mm-hmm.
But so many of us women just like function from that space, and with that, you go to an OB who isn't necessarily specialized in, well, I could probably generalize and say they aren't specialized in pelvic floor specific treatment or evaluation.
Mm-hmm.
A lot of times, when you're looking for prolapse in a laying position and you're not really trained in what you're looking for,
Mm-hmm.
when a woman's laying on their back, yeah, things probably look pretty good. So, the bulging goes away when we're laying down. And so then it gets dismissed and women go along their way and says, the OB looked at me and it was fine. So I think that the referral process to people like yourself is starting to increase more and more. I think I caught wind that like Brian is now, at least here locally, is hiring somebody on staff to be in the hospital
Yeah.
after cesareans and grade 3 or grade 4, 3-4 tears, I believe, which is awesome. Like
Well,
that's a big step.
and St. Elizabeth, my coworker, my previous coworker, I know started that at St. Elizabeth too already. So that's been going for a few years.
Yeah,
So
and
where
that's
they
huge.
get
I mean, to
automatic,
have
yeah.
both, especially in Nebraska, right?
Yeah.
Like Nebraska
Yeah.
is a little bit behind anyway.
Yeah.
But in a postpartum scenario, I feel like that's just like, 6-week appointment. Well, technically ACOG, it should be a 2-week appointment, right? At this point from a postpartum visit perspective, but that necessarily hasn't changed either around here. But the, 6-week appointment, like that, in my mind, it should just be an automatic resource. It doesn't mean that it's always taken up on, but like, you know, we may be asking about pelvic floor and evaluating the perineum and evaluating the space, but like also like what does it hurt to send over
Mm-hmm.
a referral for somebody in that space? So how are you within your profession like trying to advocate for those changes and like being loud enough that this is a resource that matters?
Oh, I mean, I think to be honest, like just continuing to talk about it with people. I, where I am right now, I'm not, I would say I'm not going to the hospitals and I'm not doing that kind of thing right now. But I think educating is just like I'm very passionate about continuing to do that. And letting women know, you know, whoever I come into contact with, and if they're willing to listen. And if you've had an evaluation with me or like worked with me, you know that I very strongly believe in um, helping women to understand like why these things are happening. Like our pelvic floor is connected to our pelvic organs, the nervous system that goes to these different places. How does our vagus nerve come into contact? What happens during pregnancy that, there's all of these changes? And then why are we no longer able to really connect to different parts of our body? Why is my back hurting? Like, obviously, yes, you had like you're holding a baby and things, but like the physical changes that go with the pregnancy period and then the sudden change in the postpartum period. I would say, like, again, education. I mean, I think helping women to understand this is a thing, like this, it's not just nothing. This is important. And there's science behind it, and it's real, tangible. Sometimes, again, when we can't see, like, it's hard to, like, again, going back to like a prolapse or something, it's hard to sometimes be able to, like, believe that something's going on when we can't really see it. And it's always just been there. Like we know that we have a uterus, or we know that we have a bladder because we pee and we have periods and we grow babies and things like that. But like it's just in there. Um, and helping women to understand that like our bodies are there to protect, or sorry, I should say our musculoskeletal system is there to protect what's underneath, like our vital stuff, our reproduction, our vital organs, and um, they they matter, and and they can cause you issues, and the issues are real, and you can have help for them. So,
Yeah, yeah. What do you feel like in the medical space is going to cause change? I mean, we're starting to see it, right? Like, at least to a certain extent. I don't know if either one of us feel like it's necessarily going fast enough, but um, I think, our point of like millennials being a little bit louder, like ourselves, and a little bit demanding a little bit more information than maybe for previous generations did in regards to our care specific for women. But I mean, to hold our physicians and to hold our providers accountable to provide care in a way that we know that we are being taken care of and that we are being, they are being educated on the things that we are experiencing because they are the professional, right? They are the experts. Do you think it's just us as women continuing to demand and continue to ask questions?
yeah.
That's causing that ripple effect that maybe we can start to see some changes within the women's health space?
Um, I think so. We haven't actually talked about this yet, but I think too, the issue is like deep, right? Like physicians don't have enough time with us. They have a lot of pressure outside to have productivity levels to do XYZ. So this problem probably isn't one that you know, a new physician thought that they were going to experience when they got, or thought that they were going to do when they got out of school or during school or whatever. Or, in residency, XYZ. So I think the issues run really deep. And um, I think we are seeing more doctors and more healthcare providers like getting back to their beliefs and wanting to provide better care. And so, I think we're seeing more like go off on their own or do things and being really successful at it. And so I am hoping that the more patients choose to, if someone is if I am going to my primary care physician or my OB or whoever it is, my healthcare provider, and I don't feel comfortable, go somewhere else. Like go somewhere that you're going to feel comfortable and, look for um, the places that are going to provide you the care that you want. And then hopefully other physicians are going to see that and that those clinics or that provider is really successful and they are fulfilled, and they are doing, they're actually providing medicine. They're providing patient care the way that it should be. And hopefully that inspires, a wave for some of the control to get back into the physician's hands. Because I think, again, like there are providers who I have no issue, or physicians who I have no issue saying like that, oh my gosh, that was disrespectful, that was gaslighting. And then there's other physicians who I wish would have handled something different, but I know that they kind of weren't able to, like they're not able to provide the care that they would like to. And so it's just us maybe voting with our like numbers, going to places that are providing us the care that we need.
Yeah, I mean, I would say using just obviously a biased example here, but like Mary Jane is as busy as she is for a reason. Like,
Yep.
I mean, she's a very busy woman right now because she has decided to intentionally take a different step. I'm curious your thoughts. I mean, again, that you're not necessarily you. I know you accept insurance now, but the realm of insurance that's affecting this, right? Like the realm of what, the physicians are required to do, or the medical codes and like all of those different things in regards to diagnosing something, or prescribing something, or what's the word I'm looking for, to have them do a test or whatever, to evaluate
Like
something,
order
or whatever.
something, you mean?
Yeah, to
Yeah.
order something, right? Like, how much of do you think the insurance space is also affecting this potential like medical dismissal, and or I don't want to say that maybe that's more medical dismissal than gaslighting in and of itself, but how much
Mhm.
is that playing into play?
Um, I think that's a huge, like, I think that's the overarching problem. I mean, insurance is great, but it dictates what physicians can do. And, if someone is potentially there might be a doctor who is not ordering a certain test because they know it's not going to be covered by insurance. And so they don't want to put that on their provider or, um, you know, uh, however, then we start to talk about like, okay, well, why are these things so expensive? Like, so it's a really deep seated issue. And why does an ultrasound have to be so outrageously expensive? Or why does this test have to be so outrageously expensive that a doctor doesn't feel like they can order it for a patient when it's the higher up that's profiting. So it's it's a
Right.
complicated issue. But
Oh
yeah,
yeah, for
taking
sure.
taking that into um, hopefully physicians can take a little bit of control back into their own hands. So
Yeah, yeah. I mean, it's kind
advocacy.
of a little bit handcuffing, I guess, a little bit. They're,
Yeah.
tying their hands behind their backs a lot, with
Hmm.
the insurance space, for especially for those the physicians that want to do more and want to serve better.
Hmm.
And the patients may or may not be aware of that, but that is absolutely something that could be happening behind the scenes. Like in my scenario, my ER bill was still astronomical without
Hmm.
getting an ultrasound. The just walking in those doors is crazy expensive with
Hmm.
insurance.
Hmm.
So
Yep.
yeah, I think there is so many levels to this, for that women and men. I mean, but I think women specifically to ourselves, but also for our children, the way that we are maybe advocating for what we're feeling and experiencing in our own children is another level of potential.
Hmm.
Um, Gaslighting and dismissal that can happen, when we're taking our kids to the doctors,
Yep.
and what we're experiencing with them in that space too. But what would be like, I guess, your biggest piece of advice for women when they're seeking out? Obviously, you said writing things down, but is there when they're looking for a new professional, or when they're looking for somebody that, if they're having, let's say, what we know to be perimenopause symptoms of midsection weight gain and, fatigue all of a sudden, and they're not sleeping as well, and what they used to do for exercise is no longer working, and all of those things that start to show up, what type of professional should they be turning to?
Um, well, for those specific things, go to a professional who knows hormones, um, which is hard to find in your general physician or again, general OB. Um, back in the early 2000s, when research regarding hormone replacement therapy came out to um, that scared people into believing that it was linked to breast cancer. And many people, this research showed that it was linked to breast cancer. There's many reasons why that's been debunked now. But
But a
that
lot of people still believe it.
a lot of people still believe it. And that entire group, well, again, that goes back to being up on research. But that entire group of physicians. And I actually heard this from a physician who was speaking about her colleagues, like that entire group, from the 2000s to recently, all they've really known about it is like, no, don't do hormone replacement therapy. Like, that's not, that's something that we just don't need to touch. Like, that increases risks of breast cancer, or that increased risk of cancer. And so it's bad. So instead of knowing how to appropriately treat and appropriately use the HRT or hormones, and assess, and like, what does this even mean? It was kind of like that sucks. I'm sorry that you're having these symptoms. Again, like, then it's going back to, it's kind of not even addressing the hormones. It's addressing what are you eating? What are you doing for your daily activities? So finding someone who really knows what they're talking about, but also find someone who you mesh well with. And if that may be like, maybe you have really good communication with this person, or maybe you feel comfortable with a provider that is more straightforward with you. People prefer different things. That's why different, physicians are great. And so don't just find someone who's open and then go and, stick with them for however long. Meet a physician. If you feel good about them, if you feel like there's someone who your concerns are well received by, then that's wonderful, if they have the skill set. And it's great to even have, someone who you can go to, and then you can look for the specialists who also like you feel really comfortable with. Don't be afraid to get second opinions or third opinions or whatever it is.
Yeah. I mean, ultimately, it comes down to, like you said, like finding your voice and advocating for
Yeah.
yourself and asking questions, which is hard for a lot of women. I think doctors have that sense of, and they are the expert in the room. It's
Yeah.
just, am I represented in their expertise?
Mm-hmm.
Is what I'm experiencing represented in their expertise? And it's hard to feel like you even know what to ask or how to ask certain questions, or ask for certain tests or whatever it may
Mm-hmm.
be. And that should be their job. Like, it should be their
Mm-hmm.
job to kind of guide you in that journey and on that journey of ultimately success for you moving forward. But, it's hard to find. There are some unicorns out there, that's for sure, but I think we're going to see more of them. I think that
Mm-hmm.
there's a lot of women that are really passionate about changing the narrative. And I think there's a lot of practitioners that are tired, like you said, of just like doing things the way that they've been doing them, and are educating themselves, and they're becoming a resource for women's health specific, and advocating for themselves. But I think to the point, and then kind of in closing here, with the issue of medical gaslighting in and of itself, um, ultimately, I think it's important that we just state like you have to be able to trust your intuition,
Mm-hmm.
like as a woman, as somebody seeking care. If your body is telling you something and you're allowing that space to listen to it, it's very important that you continue to advocate for yourself and like trust what you know to be true. You may not know what it is, you may not know like what that looks like, but would you agree that like really ultimately like that's what it has to come down to, is when you know something that you really truly need to lean into that.
Yeah. And again, like, don't settle for um if you feel something and you've gone to your physician and they say that it's nothing, but you are still feeling that way, or maybe you feel worse now because because of you don't feel heard, or that's compounding. Keep looking for someone who's gonna listen and help you. I mean, you can even, like, if you are trying to find someone, I know you could even get on the phone with someone and talk. I know that you could get, with all the resources that there are out there,
Like a telehealth. Yep.
all the people who are advocating, like a telehealth, a consult type of situation. And maybe that's not even a provider that you would be able to go with, because maybe they're not within your area. But having and hearing some knowledge from them on what you should look for in a provider, that those resources are out there. I'm on Instagram a lot, and I see them all the time. So if you're looking, now again, I don't want to tell people, like, to go and be messaging a bunch of people on Instagram, but
Right.
you can find resources. There's a lot of access to it now. And just incredibly long story short, like, follow your intuition and keep looking and keep searching until you feel good. I guess, like,
Mm-hmm.
you
Yep.
know when you feel good, and
Yeah.
everybody deserves to feel good, and you deserve to have someone who's looking after you and providing you the care with the goal of helping you to feel your
Mm-hmm.
best.
And they may not even know the sometimes the provider may not know the answer, but when they're
Mhm.
willing to go into the woods with you, when they're
Yes.
willing to like get in there and try to figure it out for you and with you,
Yes.
I feel like that is a very empowering and very good sign when you see somebody that's willing to like, hey, you know what? Like, I'm not sure, but
Yeah.
heck, like, let's figure this out. And
Yeah.
whether that's a referral or I'm going to do research or whatever it may be, like it doesn't just stop until
Mhm.
you really feel like you're getting, and you're getting better and you're feeling, like you said, like more like yourself, and your intuition knows and your body will respond in those scenarios. And we just have to learn how to trust that and
Mhm.
trust and lean into those moments. I very rarely lead us astray, um, in regards to our health and a lot of different things in our lives, I think, as
Mhm.
women.
Yep. Yep.
Yeah. Well, thank you first and
Yeah.
foremost for doing this conversation because I think it's super, super important. I would love to have you back on. I think we have quite a list of topics that you and I get to talk about over the next few weeks. But they can, if, listeners can find you on Instagram at the ladies OT. It's underscore OT, right? The ladies
Dot
underscore
OT.
OT
The ladies
dot
dot.
OT.
The ladies dot
Okay,
OT. Yep.
ladies.ot on Instagram. She's obviously here locally. Do you do any virtual consults at all?
I am happy to do, like, a phone call or a virtual consult or something. Like, usually if someone reaches out to me, we just set something up.
Okay.
Yeah, either a
Okay.
call
That's
or
good to know.
some, just individually. So,
Okay. And Instagram usually the easiest way to get a hold of you?
yeah. Yep.
Okay. Perfect. Well, I think it's important to have those resources available. And I know you and I are lucky and fortunate enough to have a web of connections that
Hmm.
we feel pretty confident in and referring to and utilizing, in and outside of our own personal lives, as well as the people we serve. So I hope that people can continue to utilize your platform and the Victor's platform to start pointing people in the right direction because we're just trying to make a movement here, make some
Hmm.
ripples and change some lives. So thank you for being
Wow.
here.
And thank you so much for having me. And thank you so much for letting me, talk about the things that I'm passionate about and go on and on and on. So I'm excited
No,
for next time.
I love it. I think this is something that all women relate to, and whether we want to admit it or not, and it's important to open the conversation. So I'm excited to get this out into the world. So I
Okay.
will see you very soon, I'm sure.
See you, Stacy.
See you, girl.
Bye.